Thank you for your interest in the Pediatric Surgery Fellowship Program at St. Christopher's Hospital for Children. I'm Rajiv Prasad, the Section Chief and Fellowship Director for Pediatric Surgery here at St. Chris. St. Christopher's Hospital for Children was founded over 140 years ago by Dr. William Bennett to serve, quote, the children of the working class of North Philadelphia, end quote. In 1947, Dr. Waldo Nelson, best known as the editor of the Nelson Textbook of Pediatrics, joined St. Christopher's and established an internationally recognized Department of Pediatrics and Pediatric Residency program. Today, the hospital hosts the Center for the Urban Child, providing complete pediatric care for children of the region. St. Christopher's has been named a top children's hospital by the Leapfrog Group and awarded magnet status by the American Nurses Credentialing Center. St. Christopher's is the children's hospital for the Tower Health System and remains affiliated with Drexel University College of Medicine, Temple University School of Medicine, the Philadelphia College of Osteopathic Medicine, and Einstein Medical Center, with medical students and general surgery residents of varying levels rotating from these programs. The St. Chris Fellowship in Pediatric Surgery, one of the original 13 programs, was established in 1962 by George Pilling. Subsequent fellowship directors have included Samuel Cresson, Lawrence Summers, William Weintraub, Charles Vinokur, Marshall Schwartz, and since 2011, myself. Graduates of the fellowship program have gone on to diverse and successful careers in pediatric surgery throughout the nation. Milestones within the Department of Surgery at St. Christopher's include the region's first pediatric kidney, liver, heart, and kidney-liver transplants. The hospital was the first U.S. hospital to create a dedicated pediatric tracheostomy unit. It continues to serve the region as a Level 1 trauma center, an ELSO Gold Star ECMO center, a regional fetal evaluation center, and the only pediatric burn center between New York City and Baltimore that is verified by the American Burn Association. The curriculum includes 1 month in the NICU, 1 month in the PICU, and the remaining 22 months on the pediatric surgery service. Fellows are on call Q4 in-house and get 20 days of vacation per year. They get standard benefits such as health and dental, and the salary is competitive with other programs in large cities. Fellows attend 2 conferences per year, APSA and the colorectal course in year 1, and then the AAP and minimally invasive course in year 2. They get a yearly book allowance, additional travel funds to present research, access to SCORE and not a textbook, and take the PSIDE exam yearly. Finally, the fellowship remains in good standing with full accreditation by the RRC and, currently, 0 citations. Once again, thank you for your interest in our program.
Hello, my name is Christopher Pinnell, and I'm the current Pediatric Surgery Fellow at St. Christopher's Hospital in Philadelphia. The program here initially attracted me because it seemed to provide comprehensive training from the simplest lumps, bumps, and lines to complex congenital anomalies and tumors. It had a good cross-section of what real-world pediatric surgery practice involves, and so it seemed ideal for someone like me who was looking for a career in clinical pediatric surgery. Now that I'm here, I can say that's exactly the kind of training that I'm getting. One of my favorite things about St. Christopher's is that I'm at the center of the pediatric surgery service here. I'm not simply a cog in the wheel of a larger institution, but rather the fellowship revolves around me and my education. I love that when a new esophageal atresia is being transferred in, the NICU will call me directly, or if there's a child with a new tumor, I'm the go-to person for oncology. One feature that I believe sets this program apart from others is that St. Christopher's is a small and close-knit community. Obviously, the 4 surgical attendings are at the center of my experience, and they're wonderful. They care about me both as a person and as a surgeon. They know my interests outside of work, my wife and children, and have even taken me out for social events like dinner or to play golf. This fellowship truly has an apprenticeship feel to it because I interact closely with all 4 attendings on a daily basis. My education is always at the forefront of their minds. They'll be sure I'm available when scheduling big cases, and even will call me if they're seeing an interesting patient in clinic. The St. Christopher's community extends beyond my small group of surgery attendings, though. Everyone here is approachable and excited to discuss patients with you. As the fellow, I have the personal contact numbers for essentially all of the attendings in radiology, oncology, GI, neurosurgery, and NICU, and will often communicate directly about patients. I'll frequently drop into radiology on the day of a big case and review the relevant imaging. Nobody here is too busy to talk with you, and in the end, it's enhanced my education and made for better patient care. I'm proud to tell people that I'm training at St. Christopher's Hospital. So if you're looking for a fellowship that will transform you into a well-rounded pediatric surgeon ready to enter a busy clinical practice, then this is a program you need to consider. Good luck, and I look forward to chatting with you on interview day.
Hi everybody, my name is Leah Siren and I was a pediatric surgery fellow at St. Christopher's from 2011 to 2013. I'm now in my 8th year of practice at Wake Forest Baptist Hospital in Winston-Salem, North Carolina, and I'm so excited to be a part of this video endeavor. When I think back to my time at St. Christopher's, I'm just flooded with incredible memories from 2 of the best years of my life. One of my favorite sayings is, you have a finite period of time during training to become the best surgeon you can be, and I will say with certainty that my time at St. Chris prepared me well for a life in academic surgery. As a surgical fellow at St. Christopher's, you'll receive tremendous experience with both index and routine cases, trauma, critical care, and also outpatient surgical management. There's absolutely nothing missing from this program. I looked back at my case logs before doing this video, and I still remember so many of those cases, who I did them with, and how we worked out the challenging situations in the operating room. There are patients from those years that I will never forget, and words could never adequately describe the impact that my time in Philadelphia had on me as a surgeon, a pediatric specialist, and a person. I still keep in touch with many of the faculty and other trainees that I worked with at St. Chris, and I'm always so proud to tell my residents and students now that this is how I do it because that's how I learned in fellowship. You really become a family with the team at St. Chris, and those relationships stay with you and are there for you for the rest of your life. Best of luck to all of you on the interview trail. Go Phillies!